Benign prostatic hyperplasia में basically there are alpha-1A subtype of receptors which when stimulated cause smooth muscle contraction resulting in narrowing of the prostatic urethra which ultimately causes the urinary retention. Alpha-1A subtype के जो specific blockers हैं these include tamsulosin and L-fusosin. These drugs block the alpha-1A subtype receptors, so they inhibit the contraction of the prostatic smooth muscles. इसकी वजह से it prevents the constriction of urethra, so urinary obstruction relieve हो जाती है. The alpha-1 blockers such as prazosin and terazosin can also be used for the treatment of BPH, लेकिन वो prostate specific नहीं होते. They also block the blood vessel alpha-1 receptors resulting in orthostatic hypotension that can be an adverse effect in a patient, especially जिसको otherwise hypertension ना हो.